for joining me. Welcome to the Menopause Annie YouTube channel. My name is Ann Miller, and today I wanted to talk about the difference between pre-menopause, peri-menopause, and menopause. Menopause officially marks the end of your reproductive years. So, but there are actually different stages within menopause that are important to recognize and understand. Menopause itself officially happens when you stop having your period. Peri-menopause, on the other hand, means around menopause. So it's also known as the menopause transitional phase, and it's called this because it happens before menopause. So although they're both part of the same overall life transition, menopause and perimenopause have different symptoms and treatment options. Any concerns or any abnormal symptoms that you might have, you should definitely talk with your gynecologist about it. So now it comes to premenopause and perimenopause. A lot of people use these two terms interchangeably, but they're actually two very different things. Premenopause is when you have no symptoms of premenopause, or sorry, of perimenopause or menopause. So this means that you still have your periods, whether they're regular or not, but you still have them, and you're still considered to be in your reproductive years. So there might be some hormonal changes happening, but there are no noticeable changes in your body. So on the other hand, during perimenopause, you'll start to experience symptoms of menopause, which may include changes in your period cycle, hot flashes, my personal favorite, sleep disturbances, and mood swings. So perimenopause starts well before you officially hit menopause. Hormonal changes are seen 8 to 10 years before menopause. So this happens during the 30s or 40s, even before the onset of perimenopause. So before you even notice anything, changes have been happening. Perimenopause is marked by a drop in estrogen, which is the female hormone produced by your ovaries. The estrogen levels can also go up and down more sporadically than they do in a typical 28-day cycle. But so this can cause irregular periods and other symptoms. During the final stages of perimenopause, your body will produce less and less estrogen, but despite the sharp drop in estrogen, it's still possible to get pregnant. So if you don't want to get pregnant, you should still be using some kind of contraceptive. So perimenopause can last as little as a few months or as long as 4 years. So now on to menopause. Menopause officially starts when the ovaries produce so little estrogen that eggs are no longer released. So this also causes your period to stop. Your doctor will diagnose menopause once you haven't had a period for 12 consecutive months, so a full year. You might start menopause earlier than normal if you have a family history of early menopause, or if you're a smoker, or you've had a hysterectomy, or you've had your ovaries removed, or if you've undergone cancer treatment, breast cancer, any other cancer treatment. Now, symptoms of perimenopause and menopause. When it comes to menopause, most people think about the symptoms more than anything else. So let's start with perimenopause symptoms. Symptoms are irregular periods, so this is when you'll start noticing things. Remember, perimenopause is around menopause. So periods that are heavier or lighter than normal, you'll have worse PMS symptoms before periods, breast tenderness, weight gain, hair changes. Actually, I went through that. I noticed that my hair was thinning quite a bit, especially around this area here, which I believe is called the Widow's Peak. Headaches, heart palpitations, loss of sex drive, concentration difficulties, forgetfulness, muscle aches, UTIs or urinary tract infections, and fertility issues in women that are trying to conceive. So now for menopause symptoms, as estrogen levels drop, you might start experiencing symptoms of menopause. So some of these can happen while you're still in the perimenopause stage. But in general, these symptoms are night sweats, hot flashes, depression, anxiety or irritability, mood swings, insomnia, fatigue, dry skin, vaginal dryness, and frequent urination. Another thing that's important to note is that your cholesterol levels are affected by the drop in estrogen. So while you're in postmenopause, so after perimenopause and menopause, you move into the postmenopause years. That's when you're at a higher risk for heart disease because your cholesterol level has gone up. So it's really important to keep an eye on that. So when to call a doctor? It's not really necessary for you to check with a doctor to be diagnosed as perimenopausal or menopausal, but it is a good idea. But what I'm saying is that you should definitely see a doctor or your gynecologist if you notice spotting after your periods or blood clots during your period, bleeding after sex, or periods that are much longer or much shorter than normal. So in conclusion, I just want to make sure that you know the difference between perimenopause and menopause, and that you should really consult with a gynecologist if any of the symptoms are affecting the quality of your life. So thank you for joining me, and I hope you found this information useful. So we'll see you next time. Thank you.